So, think of your arm as this highly sophisticated electrical grid. You've got these massive power cables routing down from the source, designed to power some very specific, really intricate devices.
Right. And the most complex tool on the entire grid.
The hand. Welcome to your custom deep dive. Today, we're taking your clinical notes and, well, synthesizing them into a clear systems-level view of the major nerves of the upper limb.
Yeah, and to map this out effectively, it really helps to start at the end of the line. The sheer precision required to articulate the hand pretty much dictates how the entire grid is laid out.
Okay, let's unpack this. Looking at the terminal branches, there is this tiny wire, the recurrent branch of the median nerve, and the surgical notes literally dove at the million-dollar nerve.
They do. Right.
Is the recurrent branch really so crucial that cutting this tiny wire during surgery just guarantees a massive malpractice lawsuit?
I mean, yeah, it's a notoriously unforgiving structure. So the median nerve is the primary power source for the lateral 2/3 of the palm and 3.5 digits.
Okay, the thumb side.
Exactly. But that recurrent branch specifically controls the forearm muscles right at the base of the thumb. Sever it, and you lose opposition.
Oh, wow.
Yeah, you basically lose the mechanical advantage of being human.
That is terrifying. And then on the other side of the palm, you have the ulnar nerve powering the medial third. But looking at the path it takes to get there, I mean, it honestly seems like a massive design flaw.
How so?
Well, it routes through these incredibly tight bottlenecks. It's completely exposed at the elbow in the cubital tunnel, and then it squeezes through Guillen's canal at the wrist.
It looks exposed, sure, but passing behind the medial epicondyle actually prevents the ulnar nerve from being crushed in the hinge of the joint every single time you bend your arm.
Oh, right, so it avoids the crush zone.
Exactly. The anatomical trade-off for that protection is, well, that vulnerability you feel when you hit your funny bone.
And send a literal shock straight down the grid.
Yeah.
I hate that. But here's where it gets really interesting. Because the hand is so cleanly divided into median and ulnar territories, the borders get kind of wild.
Oh, absolutely.
The sensory map for the ring finger is totally fractured. Why on earth does this one single finger need to be hooked up to 3 different power companies?
What's fascinating here is the underlying logic of that redundancy. I mean, you don't put your most complex moving parts on a single breaker.
Right, that makes total sense.
So sensation on the flexor side, the palm, is split right down the midline. The median nerve takes the lateral half, and the ulnar nerve takes the medial half.
And then you flip the hand over to the dorsum, the back of the hand, and the radial nerve enters the chat.
Yeah, the ulnar nerve maintains its grip on the medial half of the dorsum, but the radial nerve supplies the lateral half.
Along with the rest of the back of the hand, right?
Right. It's an incredible convergence. Splitting the ring finger ensures that even if you pinch a nerve at the elbow or the wrist, you don't lose total sensory function in your grip.
Okay, so we've mapped out this crowded real estate in the hand, but these lower arm bottlenecks really only matter if the signal successfully leaves the source.
Yeah, the power has to actually get there.
Right. So what does this all mean when we trace these signals back up to the shoulder? How do the axillary and musculocutaneous nerves fit into this grid before the major cables even reach the forearm?
Well, those nerves handle the heavy lifting closer to the source. Take the axillary nerve, for example.
Okay.
It stems from the C5 and C6 nerve roots. Think of those as the main breaker boxes coming straight out of the cervical spine.
Got it.
To get to its destination, the axillary nerve has to dive through the quadrangular space, which is this very tight muscular window right behind the shoulder blade.
And its main sensory job is the badge area, right?
Right.
The skin right over the deltoid where a military patch would sit.
Exactly. But if that nerve gets compressed in that quadrangular space, you aren't just losing sensation.
Wait, really? What else?
You're likely losing shoulder abduction, too. You physically wouldn't be able to lift your arm out to the side.
Wow, so that's the danger of a bottleneck near the source. And then moving slightly downstream, you have the musculocutaneous nerve.
Right, which punches right through the corpus brachialis muscle to power the anterior arm, so your biceps and brachialis.
But once it finishes that motor job, it doesn't just stop there, does it?
No, it actually transitions into a purely sensory role.
Yeah.
It continues downward to become the lateral antebrachial cutaneous nerve.
Handling sensation for the lateral forearm.
Exactly, completing the circuit.
It's wild. Every zone has a dedicated, purposeful cable. When you look at the whole picture, from the axillary nerve at the shoulder badge, down the musculocutaneous in the forearm,
all the way to the radial, ulnar, and that million-dollar median branch in the thumb.
Yeah, your arm is just a masterpiece of precision routing.
The engineering is highly efficient, though. That efficiency relies on routing critical, irreplaceable cables through some very hostile terrain.
Which brings up a slightly terrifying thought to leave you with.
Oh.
Considering how tightly packed these nerves are as they travel down your arm, especially the ulnar nerve squeezing through the cubital tunnel or Guillen's canal.
Yeah, there is zero extra room in there.
Right. So imagine how just a single millimeter of swelling in your wrist could entirely shut down the power grid to half of your hand.
It's crazy to think about.
Think about that the next time you lean on your elbow.